Okay, we'll get started. Today is Tuesday, December 19th, 3 p.m., and this is the Burleigh County Human Service Zone Board meeting. So I will call the meeting to order, and then next thing on the agenda is the oath of office for Commissioner Bakken. He is not present yet at the meeting, so we're just going to skip that in case he does arrive here, and then we'll go back to that one. So we'll just go to the next item, which would be roll call of the members.
Galen Becker,
Here.
Jim Holm,
Here.
Leslie Piercy,
Here.
Director Flory.
Here.
All right, and that's everybody here currently. Trevor, are you on? Nope, Trevor's not on yet. And then Senator Dever and Tracy Famous are both absent
Yes.
as well as Commissioner Bakken at the moment.
Senator Dever did let me know he wouldn't be making it today, and then Trevor, if he joins by phone, we'll get him when he jumps on. But otherwise, not sure if Tracy and Senator will be coming in, or sorry, Commissioner will be coming in late. So next thing would be the approval of the meeting minutes for the October 17th meeting. So I don't know if anybody's had a chance to look those over, if anybody wants to motion approval of those minutes.
Motion to approve.
I second it.
Okay, so we have a motion and a second to approve the minutes from the October 17th meeting. I'll just say all in favor, say aye.
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 Any opposed? Motion carries, so those are approved. After that, we'll just go into the report of the programs. So I'll start with the Economic Assistance Unit. Last month, we talked regarding economic assistance, just some of the changes that were happening through a statewide effort. So this is to address backlog that's happening in these programs across the state. So we were functioning historically as just a county, so we really focused on Burleigh County, and then we moved into a regional pilot in our program in February of 2023. And so as we were operating within the region, which would be Burleigh County, Dakota Central, Three Rivers, Human Service Zone, Southwest Dakota, and Rough Rider. So really the Southwest region of the state. So we were sharing all our work together. It was determined by HHS back in probably October that it would be best if we moved into a statewide effort. So what they were seeing was certain areas of the state were backlogged on constituents getting and consumers getting their benefits timely, where maybe we weren't seeing that backlog. So we were really only backed up like a day or two, or maybe even a week on processing some of those applications for those programs, where other areas of the state were maybe weeks or even months behind. So specifically in LIHEAP season for the fuel assistance, they were backed up months. It was October and they were still trying to work applications from August. So it was really this idea of sharing the workload to get things moving. What that means for our local community is that they're going to see a backlog that they haven't experienced. Typically in Burleigh County, we are very timely. And there's many reasons for that. Is that a staffing model that we've been able to have that's kept up with the work, or is it a performance thing that we've kept up on the work? So anyways, our clients locally have definitely seen more of that backlog from going statewide. So that as a local board is something that you could hear from your constituents that that's not being processed as timely as they may be used to. There's some other contributing factors, like we were under the public health emergency for the Medicaid, so that was lifted in February, which caused backlog to Medicaid program, because under the public health emergency for the last few years, we've been able to process cases with a lot less information needed. You were almost just kind of like grandfathered into those programs based on certain things with that public health emergency, and now it turned into where you had to go back basically through the full regular process. And so some of our workforce, if they were newer, had never completed that process with out the public health emergency in place. So some of it was a learning curve and some training. But so with that, we definitely saw that's impact to our staff. I mean, I'm not going to say that it's not. Our people who are used to doing their work and keeping on top of their work, that's definitely a performance thing that they're just not used to. You're not at the end of the day crossing things off and feeling accomplished. Every time they open up their queue, it is full of more and more work. So part of it is just changing that, which is hard. But then also part of it is just concern at you know, you do good work, you get more work. So trying to have the conversation of what are we doing to address the performance issues that could be happening around the state. So those, I guess, as the director, are the biggest things that I am looking at with other directors, like where's that accountability? Like, I get it that we do it for the clients, and that's always in our forefront, and I understand all the clients in North Dakota, not just my local ones, but statewide. But at the same time, there is a burnout to staff, and there's a morale thing if we're not addressing the performance. So part of it is working with the department on what they call the dashboard that will show you work that's being completed. You can search the dashboard by employee, so you can see. So what I've asked them to do is, and we're separated into groups based on programming. So for group one is our Medicaid programming. If they were to pull that dashboard up for all the group one workers statewide, where are your top performers? Where are your lower performers? And then what are you doing to address the discrepancies in the work performance? So that's just one thing, I guess, for that. Does anybody have questions so far on economic assistance? Any thoughts or feedback? I guess if you're hearing things from your community on their concerns or complaints on this. The other biggest thing that we see is the issuance of the EBT cards. So I know we talked about the last meeting that we as directors have supported this initiative to bring the EBT card issuance back to the zone. The response we got from the department is that they will work on that and getting that, but it just takes time. They have to get our equipment back to us. You know, there's a machine that you use to issue the cards, and then there's a training that will need to go on for staff. So that is still the goal. For my goal, I know we don't meet again till March. Personally, I would love to come back in March and tell you that that's back in house and we're doing it. We still see a lot of foot traffic for people, especially during the holidays, saying I need my EBT card to be able to go get the food to feed my family. You know, whether they lost the card or the card is damaged and not working. But there's this delay. There's like this 2-week delay in getting the card to them. So.
Hello, for that on the line.
Hi, Trevor. Thank you for checking in. We've started the meeting, so we'll keep going.
Okay.
Part of the consideration for the board would be feedback on the data that we provide you. So again, doing statewide work, I could provide you with data that shows you what my workforce is doing for productivity, but that's going to be looking at statewide consumer, you know, because we're working the cases statewide. Or does the board want me to focus more on the clients that we're serving in our community? That look is going to tell you how many households we're serving in Burleigh County, how many dollars that we're spending in the programs to function these, to keep the households intact and with the services and benefits they need. So there's different ways that now that this has shifted that I would pull the data, and maybe you want both. So part of it is just for the board to think about what do they want as an outcome from the data that I'm pulling? Because there's two different ways to get that data. Yes.
Are the number of cases going up or going down in the last couple of years?
Oh, Tan, we just digested this data, and I feel like we felt like we were maintaining, yeah. So there's some discrepancies in some of the, depending on if I look on the dashboard or if I look at our original data for your local clients, there are some discrepancies. But when we look at our true steadfast data that we've always used, that is staying consistent with the number of households using our, and some of the things, so I guess this is just my opinion as a local community board, I would be more interested in my local community efforts. Because some things I think are interesting is the household demographics that we are getting Medicaid to. Is it like most of it's your under the age of 5? Is it most of it's your 65 and older? To me, what that tells us is as a community where we need to put our efforts. You know, if it's your 65 and older population that's using our benefits, are there other things and initiatives we could be doing in the community? So,
I agree with the local data being what I would be more interested in, unless there's something at a statewide level that helps us understand, you know, what you might be experiencing with your own staff and the frustrations that they're feeling. But otherwise, I think it's all about the local data.
okay.
Chelsea, and I guess to Galen's point too about historical trends, I think we're kind of in a unique situation, like Chelsea had said, coming off the public health emergency and kind of having different qualifiers during that period, that last year to this year, your numbers may look different just based on those, that program change.
Chelsea, do you look at, like stats from other zones? I mean, as far as like quarterly stats or anything like that, and compare them to the zone here? And the only reason I say that is if there's a zone that is seeing a decrease in a certain area, and maybe they're trying a new way, so to speak, and it's something that could be utilized here, or maybe adjusted or looked at. I mean, I think it's always good to look at what you have going on in your own house, but if you got the house next door that they're reducing in certain areas and they're just trying something different, new program, new training, anything like that, I think it's worth looking at, not necessarily needing it all the time, but
It's just putting context around the numbers,
Exactly.
right? And which
Yeah.
is what we won't have with just raw numbers.
Exactly.
No.
Just a thought.
No, good thought, good point.
And I guess too, if I can add, like with the redesign, you know, they initially broke the area up into 4 quadrants. There's regional managers per each quadrant, and those still exist even with the sharing of cases statewide. So those 4 individuals would kind of work together too to kind of look at more statewide
Yeah.
metrics is what I assume would be occurring at that level, you know.
Yeah, good point. Sorry, just thinking, okay, so we agree with the, being more that local data unless there's a statewide reason for the staff frustration, which is exactly kind of what, I talked about today, like that backlog. Otherwise, that statewide data for performance, I believe that the board would trust that we're using that internally to address performance. I would like to think that my staff are going to be the top runners of that statewide pool, but in the event that we do that and we look at a group and I can say, okay, 5 of my staff were the low performers, we really need to look at how to get them up to that higher, at least the midline, at least what's your benchmark. So, okay, that makes sense. And then looking at the quarterly stats, at least from each zone, or the surrounding zone, sorry, and then trends and strategies is what I'm hearing. Like, are they seeing the trends? And then if so, why? And is it
Exactly.
and because if it's an uptick, maybe there's something I can share with them on a strategy, or if they're seeing less. Okay, that makes perfect sense. So like Tayon said, we meet, we have a regional manager who really looks at that, but I also meet quarterly, I believe it's quarterly, it might be every month, but every other month, but at least quarterly with some of the surrounding zones. And we just try, because we share community resources, so we just try to get together and do that. So that would be good ask for me to see where they're at. Okay. That gives me direction for our March meeting. Not that we can't change what we're doing. I mean, if we meet in March and even halfway through next year and we're like, we'd like to look at the data different, we can do
Yeah.
that, yeah. But at least now Tana and I know where to go with it, so. With that, so we do have a group of our workforce, so we refer to them as Group 4s, but that Group 4 work statewide is regarding your TANF, so your temporary assistance for needy families. So they have been picking up additional duties through economic assistance, whether that's responding to emails being sent in, because constituents get email in like, hey, where's the status of my application? Or they've also been kind of deployed to do some work in Group 3, which would be our like SNAP benefits. So, and then the LIHEAP, because again, we're seeing the backlog in the LIHEAP, and we don't want to, we're almost, halfway through LIHEAP season for fuel assistance at this point, and we still have people not processed who have applied. So the Group 4 employees, and within our region, those are all Burleigh County employees. That's just kind of how that fell. There was no intention. They just were all employed here. They have done amazing to pick up additional duties. I know that it's caused a lot of frustration, burnout, mental fatigue for them. It's really just a change fatigue. You feel like you come to work every week and I might be telling you new duties we're going to be working on. So, part of it is a flexibility and a growth mindset for that, but part of it is just honestly recognizing that we can't continue to ask people to pause and pivot every other week.
Yeah.
People got to sit in something for maybe 6 months and adjust, and then, so I do advocate to the department that, like, there was a change they implemented, and then after maybe a month, it was like, well, maybe that wasn't a good change. And even if I didn't think it was a good change, I'm still saying we got to leave something in place. We got to leave a change in place for a minute and let them work in it. Otherwise, it just feels a little out of control. So those are kind of efforts that we're doing with that. As far as our staffing for economic assistance, we are fully staffed. Correct, Tian? We don't have any open, yeah, so we're fully staffed in economic assistance, so, again, we always look at when the department's saying, hey, we need to add additional FT, full-time employees, or equivalents with it, but full-time employees for, like the call center, they'll ask what zone wants to pick up those FTEs for, and we could choose to do that. So we always offer when there's positions open, and then the department makes the decision on what zone they believe should pick those up, so. But right now, we're fully staffed in economic assistance for what we have. That is pretty much all I have for that unit. Child welfare unit, so I would say that we are fully staffed in our child welfare unit as far as like our CPS unit, our in-home unit, and our foster care unit. We just onboarded our last foster care worker on Monday was his first day. So we are fully staffed. The only positions that we're still open with would be our parent aid. I'm just gonna count that we're fully staffed because I feel like my parent aid constantly has turnover. It's just it's just an entry level position, and so it's just kind of chronically has some turnover to it. The team that we have right now in our parent aids, fantastic. It's just this last position, we are struggling to secure applicants or a person to offer the position to. So Tan and I have talked, creatively about what to do with that position and some consideration around maybe making that full-time position two part-time positions, thinking maybe we'll hit a different pool of candidates, like whether they're college students who are looking for some hours that we can work around their schedule, or somebody who might be retired or just looking for some part-time work. So we're just trying to get creative, to be honest with you. We just need to get that position filled, so.
And just to clarify with that, we do have interviews planned for the full-time position opening, and then depending on how those go, hopefully we'll be able to fill it with this round of interviews as is. Otherwise, we'll look at making that change afterwards if we're still unsuccessful. And I've told Chelsea this before too, the holiday season is a tough season to fill positions for any position. It's tough people aren't trying to or wanting to look at changing jobs and changing benefits and things like that around the holiday season, and taking time off that may have already been planned and things like that. So it's kind of a tough time of year to fill any position. So it's not totally unexpected, but we do have interviews scheduled for this week, so for that position specifically.
Yeah, no, thank you, Tayon. And good point too, and maybe there's consideration, we wait till the holidays and try one more time for the full time. Tayon is very familiar with the trends for applicants that we see historically. So just kind of thought around how to do it. But like I said, otherwise we're fully staffed, and as soon as we secure an adoption for a sibling group of children, there's more kids that come into care. So the caseloads continue to maintain pretty consistently. I met with my child protection team this morning, and they, just talking about cases that are coming in, what's that looking like, and it's very steady and heavy. We're averaging that they're getting assigned maybe 3 new cases a week. So continuing to monitor that trend, and like I said, we're up 10 workers within that unit, but just really monitoring, is there need for more as we look at that. So within that unit, some of the improving, now that we actually have staff, I feel like we're kind of out of that crisis response, and we're now looking at quality and the services that we're providing. So within the child protection team, some of the focus we're looking on is obviously our face-to-face timeliness. So depending on the category of the case, they have policy requirements for how soon they respond to the victim and the family. But we're also looking at how long the cases are staying open. So I believe it's 62 days that the case is open until you have to request an extension, and the reasons for your extension are they should be a specific criteria. So we're just not keeping families open with the assessment for a long period of time. So we are starting to monitor those things with more so the intent of how to support the staff. There's no punitive intent that you didn't meet the deadline, there's disciplinary action. It's more like, you didn't meet the deadline, let's look at your current caseload. Is it the kind of cases we're giving you all at one time? Some of them are more time consuming. Some of your A-level cases can just require more work. So some of your cases where there's maybe some underlying custody issues can really tie a worker up. They're getting roped into some of that communication with attorneys and families. So, yeah, we're really just trying to focus in on how we can support them. Are there additional tools we can put in place for typing? A lot of times staff are saying, I have everything done, it's just I got to type up my report. And so what can we be doing? Is there a position we could be utilizing to help with some of that clerical type things? Is it tools like, I think we talked before about Dragon Speak or dictation that we could be utilizing? So I just wanted the team to know that I feel like we're shifting kind of into quality for that piece. Any questions around any of that? Some of the additional efforts for the child welfare unit that I'd say that I would be doing, our agency would be doing, is we participate in the federal review. So this is like through Child and Family Services, the work that they were doing to report to the feds. And so there's a couple work groups that I participate in, one regarding community services and then one regarding community engagement. Luckily, those are both things I'm really passionate about. I don't know if that was strategic when I was picked for those work groups, but those are things I enjoy. So really, we're talking about what we're doing in our communities. How can some of these things be implemented around the state if other zones aren't doing them? Kind of sharing some of that knowledge and looking at the efforts that we're doing and do they really drive, good quality services. Some of it's hard because like my community engagement, there's not a lot of data pulled back to that. I can have collaboration meetings and I can have good community partnership, but you might not tie that back to a direct data. But so a lot of that is just because it's good to have those relationships. So then when families are in crisis, you can pull together and you can actually serve them in a meaningful way. So the community services will be a lot more easy to identify, what we would call like service area deserts, where they don't maybe have services in some of these rural areas that we're fortunate to have because we live in Bismarck. So other things we worked on, we were able to have a training come in for like their drug recognition. So just when my staff are working in the field, on maybe having more knowledge and when the family they're engaging with could be under the influence, or maybe recognizing some of those things for safety when they're in there. So that was a nice training to have done. I think the highway department was a member of them, put that training on for my staff. I've done presentations through Bismarck Public Schools. Recently, I was able to do their social workers, their special education, counseling, kind of their support staff regarding how to file a 960, what goes into the 960, what to expect after it's done. So just, again, community collaboration and education, just keeping that line of communication open. And then the last thing I think would be important for this board to know is continued work to find somebody to be a certified shelter. So right now in Bismarck, we don't have a certified shelter. YouthWorks was our shelter. And then with some of the regulations and changes in order to be a shelter, they just weren't able to meet those needs or chose not to. So we're continuing to work for somebody. It would be an RFP that's put out by the department that they would engage in and then become a shelter. So this is just always a great platform to say if anybody's interested in doing that. There's a process. You become certified, so there's requirements for the windows in the building and being up to code on certain things. But really, you would be saying that you're going to staff this shelter so that if we had a youth that we need placed there for 7 to 14 days or less, depending on the needs of the family, that you have you're willing to take those children in and be really a safe place for them to be. So right now we don't have any. But we are engaging with our DJS partners, our tribal partners. Trying to think of and then the department to try to look for some of those people. So when somebody comes forward, like we had a church in town who was like, this might be something we wanted to create, like a community rec center for youth, and maybe this is something that could be in addition to that we could serve as this purpose. We just met with them and had conversations on what that realistically is going to look like. And after that, it's kind of up to them to decide if they want to move forward. It's a commitment. So, any other questions for the child welfare portion of the agency? I mean, I think we're staying pretty consistent with a lot of the, it's hard. I mean, like I was gonna say with the caseload that we're seeing, I don't see anything that I think is like a huge difference in a trend, I guess. Our foster care, it's pretty much in line with what we did for these times last year. or the last 2 years. CPS, when you look at that first, graphic, you know, we're trending higher than we did in 2022 and 2021, which again is just good supporting information why we added that 10th worker to our team. And then in-home case management services, you know, I always share with everybody that our in-home case management is a voluntary program. You know, we identify that a family has maybe some concerns within their household for what we refer to as impending danger or the need to have a case manager involved to help them with services. But ultimately, if a family shuts the door on us and says, no, thank you, it's a voluntary thing. Now, we do staff these cases with juvenile court when we feel like there's a significant safety. And then what we're looking at is, do we have enough of a concern to be issued custody of these children is really that next step. I always like to tell people, we don't take custody of children, we are given custody of children, either through law enforcement or the court. So law enforcement would be more of our present danger, this is happening now. The court is more when you could draft those historical affidavits and we could go before the judge and say, based on this information, families' refusal to engage with us, there are concerns. We've tried to be least invasive and it's not successful. So sometimes those trends can go up and down, but like I said, if the family isn't engaging. So we really utilize that team to help with some of our foster care work. We also have some of those team members who just carry foster care cases. So if they're working with an in-home family and then an incident occurs that we end up taking custody, we try to keep them on that case if appropriate. A lot of times it's a different level of knowledge for policy and procedure, so it's not in the best interest to leave it on that worker, but we always weigh out how invested are you in this family and can we teach you some of those things, so.
Chelsea, I have a question. In past meetings, you've talked about the challenges of getting new workers trained through the training that the department puts on.
Mm-hmm.
Has there been any movement to have more training options available throughout the year for new workers throughout the state?
Yeah, good question. Two things for that then. So on a director level, I'm part of a work group and my focus is recruitment and retention on the workforce. And so part of that is looking at workloads and what, people will call it a caseload versus a workload, because not every case is the same. So you could have 12 cases and the guy next to you could have 12, but the level of work that goes into year 12 is a lot different. So really we're trying to come up with maybe there's a weighted system. And what are we looking at in that weighted system? The number of kids in that home, the situation with the parents, the level of services needed for that family, different things like that. So there's conversation regarding that. And then part of that is that retention of the staff and getting them trained in. So we are trying to, we're just at the beginning phases of then approaching the contractor who does the child welfare training for all the staff statewide and talking about how can we have this training more often, virtual, really revamping it.
Yeah.
I think a lot about how the foster parent training goes where you complete modules at your leisure and then you maybe attend an in-person training. So could it be something where my staff start day one and I start getting them assigned these modules to work on? We all know that when you first start, it's like the first day is really wild with maybe doing your orientation and some of those things, and then you have a lot of downtime in between. So that would be my idea, but it's not just up to me to make that idea yet. So, so again, great that I was put on that work group because that's something I'm passionate about.
Yeah.
In the meantime, to get staff trained, the department does offer through the Child and Family Services Unit what we would call refreshers or booster sessions. So I get invited to them, my staff get invited to them to attend as they're able to, and then they just focus on certain topics of the work we do. So there is that effort, but yeah, I agree with you. I'd like to get staff through the appropriate training because, I have people who are going to be going this spring to that training and they probably are going to have a caseload by the time they go. That's just not productive. Second part to that then would be we have a trainer position we secured at Burleigh County. We finally have, it was an internal move for one of my case managers, so they had to work to get their caseload off of them. And so they're probably now operating more fully in their trainer position. So that's really focusing though on a more of a local effort, like skills needed to run a child and family team meeting. Those are meetings that we're required to conduct quarterly for foster care. And so it's running a good quality meeting. Not just reading a script, but really engaging with the family. They're working on how to write a good affidavit, how to testify in court, how to have tough conversations with foster parents. So it's really more of your that local, not the same training that they, so two different types of training we're trying to do. And that's, I believe, helpful as we're onboarding. I think about my foster care team, of the 9 members in that unit, 6 of them, or maybe like 5 of them, are either right at their 6-month period or they're in probation. So it's not a good onboarding process that we probably have had historically. So this position will really help in that onboarding. Sometimes we're assigning this trainer as just a secondary worker to the case. We might have a new worker, even if they're in their year, they've gone through their probationary period, but they get a case that we're like, this is tough. But you're the person with the caseload who can manage this, but you might not know how to do it all. We assign this trainer as a secondary person, so just they can be really more involved and then give tips and guidance on where to drive the case from here. That has been productive. I think we were talking today that since I've become the director, we've been able to add growth. I believe we're at like 7 or 8 positions we've added to the county, just specific to child welfare. And I think that, we're getting good feedback from our community partners. When I presented to the school, they just talked about the great response they're getting for timeliness from my staff, like on responding or getting a hold of us or getting updates. And, they were like, well, kudos to you, Chelsea. And I'm like, well, to me, it's kudos to my team, because now that we have on the appropriate staffing model, people can actually have time to do those pieces of their job. So I do think that we've expanded the team, but it's all been, we're functioning much better. Any other questions for child welfare? Other zone updates that I would go over would be, one of the big things would be the purchase of a county car. So we were approved in our 2024 budget for the purchase of a vehicle. Right now we have, a Malibu that, and Tay and I do not have the mileage in front of me, but it's like well over 250,000 miles that we're sitting on this Malibu. And they, it's just a small car, so it'd be nice to get a bigger vehicle that could be used when we're having multiple children in the vehicle. And
You need a minivan
Yeah.
or more.
yeah, I think the idea would be if I could get like an all-wheel drive minivan or some sort of vehicle. So I did go to commission to ask for, kind of guidance on the process of purchasing one. Is there a bid process? Can we just purchase? What does that look like? And I've had, so for Jim, the Sheriff's Department has been amazing in giving me guidance on where to go and what to get. So I did reach out through the bid process. There is a point of contact. And so I did go through the process and made a request that there's interest in purchasing a specific vehicle. So I'm just kind of waiting through that process right now. Again, this is for my 2024 budget, but I was, when we meet with our state fiscal year end, we have additional dollars in our budget. So it was, you could still try to get one at the end of 2023. I just don't know that we're going to meet that timeline to secure one with those dollars. So I'm really focused on, for sure we need one in 2024, but with that, we'd probably get approval to get another one if we need. So some of the work that we're doing is showing them like what we're spending on rentals or what we're paying out for staff using their own vehicle for mileage. So I just think that's important for the board to know, but that'll be great. My team have been probably asking for a new vehicle my entire time I've been here. So it's I'm working on it. Yeah, I guess the only other thing I'd share then for the entirety of the zone is just really working on staff morale and some of that team building stuff. So we were able to create I'm going to say like a planning committee that would include both my child welfare staff, my academic assistant staff, and then they'll make sure to represent our administrative staff too, on just trying to plan like regular quarterly, whether that's a potluck or they're going to get together outside of work on their personal time to do different activities, just really in the spirit of team building and connecting outside of just when we're in crisis and working on cases. So I think that's huge kudos to our team. They facilitated a outside after hours work Christmas party, and it was just great to see people get together and connect with each other. You might only operate within your unit typically during the week. They kind of stay siloed, and so to see people mingle outside of that was fantastic, and everybody had a really good time. So just excited to see more of that. And then I think one of my goals for 2024 is to work on doing more recruitment for foster homes. That is not a duty of the zone. There's a unit who does that through the department, but I still think that there's a local voice that we need to have. So just looking at opportunities to get out there and promote the need for foster homes, and then obviously we would then direct them through the department for the licensing process. But that's a goal for mine in 2024, is to have a regular cadence on how often we're doing that kind of stuff. Any comments, questions, concerns? Any feedback that anybody wants to share on training opportunities that they think we should be taking part of for our staff? One thing that we've talked about is mental health first aid training for my front administrative staff, as well as like economic assistance when they're dealing with maybe customers on the phone who are in maybe a mental health crisis. So that's one thing that we've talked about, but I think my child welfare staff are about trained out at this point between their required training and then things that we bring regular speakers in to train on topics, like I said, that drug recognition, or different things. But if you guys have anything you hear of and you would like to send my way that you think would be a good opportunity for my team.
I noticed on the foster care case management for the year, November was the first month where it was about average for the past 2 years. Before that, all the other months up through October, it was higher than the averages for the past 2 years.
Yeah.
Any comment or insight on it? Is it just more kids needing foster care placement?
Yeah, so I just think it's, we talk about this a lot as directors too, when you kind of go back, you're not going to see 2020 on here. So we just celebrated the 3rd year of that safety framework that was implemented through the department. So part of this variable could be that since then the framework has helped us guide who we should be serving. It just gives you a better compass on who needs to be served. And it's more of a threshold we go through. So does that mean we're serving more people because we're actually identifying the correct people who need to be served? One could say that. One could say it's the population in our county. More people here, more odds that you might need somebody who needs our intervention. Different things like mental health crisis or substance use issues going on in your community. So there's a lot of variables that could say why we're having more in care. Since August, we've probably had a lot of cases where we've been able to secure permanency. So I would relate that direct downward on the caseload to that. We've done a lot of work for permanency. That's securing adoption for kids. So we've had a lot of sibling groups we've been able to adopt, and then they're no longer in that caseload. And so, again, I would argue that the more staff I have, the more efforts can be made towards permanency. You have more work and time in your day to spend calling relatives, doing those relative searches, connecting with what we would refer to as children's fictive kin, or they're just natural supports. I mean, we've secured permanency with a teacher at the kid's school. Anybody who's got vested interest in these children, are you willing to be a permanency option? And then we start exploring guardianship or getting them licensed to be a foster parent so that they can do those, move forward towards permanency. So I would say that since August, as we were onboarding staff, we're spreading out our caseload, so then there's more quality work going into the permanency, would be what I would attribute that to.
Prior to August this year, I see it was quite a bit higher than previous 2 years. Is there any insight as to what the makeup of those groups are, or is it pretty much straight across the board? Or is there any subgroups where we're noticing an increase?
When you say the makeup of the group, what are you talking? Age, ethnicity? Like what kind of makeup are you saying?
It could be ethnicities or nationalities or immigrants that have come to the country. Is that more part of it? Wondering what
Yeah.
the breakdown is. I'm just curious.
Yeah, so part of this, what data did I just look at? So we have quality assurance that reviews our cases. There's a quality assurance team through the state, and then they review the cases front to back, and they do polls on those. They look at that data, and so we actually did just get graphs and pie charts about the number of cases they pulled, ethnicity, and there is no there's no trend, I guess, for that. It was pretty. I mean, most predominantly we're serving Caucasian or Native American. And those are, I think, both 33% of each of that chart. And then the other makeup of that chart was either unknown, African American. Yeah, so I mean, majority of the people we're serving are, we focus on, if you're looking for a cultural question, it would be Native American. And that's just I think, North Dakota for our location with tribes. But honestly, there's no real strong connection to any one tribe. We're serving tribes outside the state.
So there's no increase due to
No.
immigrants? Okay,
No,
thank
absolutely
you.
not. Nope.
Okay.
Yeah, I would have no data to support that, and no information that we have a caseload for that. I mean, sometimes we look at, like, we do get one-off situations where we had a family in care where they might be from another background, and we have to utilize like maybe a translator, and so we're working with community supports on that. But those are really rare that we're seeing any sort of.
How do you use the urinal?
Okay.
So, yeah, I can continue to, as those quality assurance things come in, and, you know, to your point, Galen, the more important thing, I think, when I get that data has nothing to do with the ethnicity background. It's more the age that we're serving. I find that more interesting when I'm looking at the number of kids in care are maybe 5 and younger, or teenage, or whatever age. And then, like, what are we doing for the families of children those age? Is it because they're more vulnerable and there's substance use going on in the home, or is it because there's more parent-child conflict that's resulting in domestic violence incidents that then they can't be in the home? So where am I focusing my prevention dollars? Is this education on nurturing and parenting, or am I doing substance abuse and maybe mental health services? So,
Thank you.
yeah.
Just let it go.
Okay, so that's really all the updates I have for anything, Tan, unless you're thinking something I missed that you think.
No, I don't have anything else.
Okay. Next would be public comment. There's no public to comment, so we'll skip over to other business, which, we have our dates set for, the new year. So there's really, I don't have any other business. Those are, already, you guys would receive those, so, I don't really have anything for other business. And so if nobody else has any other comments, questions, concerns, we'll adjourn the meeting. Thank you, Trevor, for joining on the phone.
Yeah, bye.
See ya.
Thank you.